Leg cramps, especially those that strike in the middle of the night, can be a painful and frustrating experience for many seniors. Often, these cramps are caused by a combination of factors such as dehydration, poor circulation, and a deficiency in essential nutrients. One of the most significant contributors to leg cramps and muscle weakness in older adults is a lack of key vitamins and minerals. As we age, our bodies absorb and utilize nutrients differently, making it essential to focus on specific vitamins that can help prevent these painful episodes. Getting the right vitamins not only supports stronger muscles, but also improves circulation, which is vital for leg health and function. Several essential vitamins play an important role in reducing the occurrence of leg cramps and helping seniors maintain their leg strength, ensuring better mobility and less discomfort. By incorporating these vitamins into your daily routine, it is possible to strengthen your legs, reduce cramps, and feel more stable throughout the day and night. Vitamin D. Vitamin D is essential for maintaining strong bones and muscles, especially as we age. It helps the body absorb calcium, which keeps bones from becoming brittle. Without enough vitamin D, calcium can't be absorbed well, increasing the risk of osteoporosis, fractures, and muscle weakness. Seniors with low vitamin D levels often face balance issues and frequent falls. Vitamin D also supports muscle strength and helps reduce leg cramps, which are common and painful in older adults. These cramps can stem from various issues like dehydration or nutrient deficiencies, but vitamin D deficiency is a major cause. This vitamin aids proper muscle contraction and relaxation, helping to prevent aches and weakness. Low vitamin D levels in seniors can lead to osteomalacia, a condition where bones soften and muscles weaken, making it hard to walk or do daily tasks. With age, the skin becomes less effective at producing vitamin D from sunlight, and the body's ability to absorb it from food may decline. That's why many older adults are advised to take supplements. Beyond bones and muscles, vitamin D also strengthens the immune system. Seniors with enough vitamin D are less likely to get respiratory infections, which can be especially hard to recover from in older age. Getting vitamin D isn't limited to supplements. Sunlight and foods like fatty fish, fortified milk, and cereals can also help. However, too much vitamin D can be harmful, causing issues like nausea or kidney trouble. That's why it's important to get levels checked and follow medical advice. Most seniors need 800–1,000 IU daily. In short, vitamin D supports mobility, reduces cramps, and helps prevent falls, making it vital for healthy aging. Vitamin B12. Vitamin B12 is crucial for healthy nerves and red blood cell production. As we age, the body struggles to absorb B12 from food, increasing the risk of deficiency. One early sign is numbness or tingling in the legs, often mistaken for other issues. B12 supports nerve communication between the brain and muscles, and low levels can cause weakness, fatigue, and leg cramps. With age, the stomach produces less intrinsic factor, a substance needed to absorb B12. So, even if seniors eat B12-rich, food's absorption may be poor. Low B12 also reduces red blood cell production, which limits oxygen delivery to muscles. This can lead to weakness and cramps, affecting mobility and physical activity. Vitamin B12 is vital for maintaining the myelin sheath, a protective layer around nerves. Without enough B12, the sheath deteriorates, leading to nerve damage. Seniors may feel tingling, burning, or numbness in the legs, making it harder to stand or walk comfortably. Poor circulation is another concern. Nerve issues caused by B12 deficiency can reduce blood flow to leg muscles, leading to painful cramps and spasms. Adequate B12 helps keep nerves healthy and circulation steady, reducing this risk. B12 also works with folic acid to maintain nerve health. It's mostly found in animal products like meat, dairy, and eggs. Seniors, especially vegetarians or vegans, are more prone to deficiency. Supplements can help, especially for those with dietary limits or absorption issues. Left untreated, B12 deficiency may cause permanent nerve damage or even memory loss. Seniors are advised to get about 2.4 micrograms daily, with higher amounts if needed. Pills or injections are both effective, and regular blood tests can ensure levels stay in a healthy range. Magnesium. Magnesium is essential for maintaining healthy muscle function, and it plays a critical role in preventing leg cramps, especially in seniors. This mineral is involved in the relaxation and contraction of muscles. When magnesium levels are insufficient, muscles are more likely to tense up, leading to cramps and spasms, particularly in the legs. Leg cramps are a common complaint among older adults, often occurring during the night or after physical exertion. These cramps can be painful and disruptive, affecting sleep and daily activities. Magnesium helps to ease muscle tension and supports muscle relaxation, making it an important nutrient to include in the diet to reduce the frequency and intensity of leg cramps. In addition to preventing cramps, magnesium also supports overall muscle strength. It works in conjunction with other minerals like calcium and potassium to ensure that muscles function properly. Magnesium helps muscles maintain their natural rhythm, promoting coordination and proper movement. A deficiency in magnesium can lead to muscle weakness, which can further increase the risk of falls and mobility issues. Seniors with low magnesium levels may find that their muscles feel stiff, weak, or fatigued, making it harder to stay active or complete everyday tasks. Ensuring that magnesium intake is adequate can help prevent these issues and maintain strength, allowing seniors to stay independent for longer. Magnesium also contributes to bone health, which is particularly important for older adults. As we age, bones naturally lose density, which can lead to conditions like osteoporosis. Magnesium helps with calcium absorption, a key factor in maintaining bone strength and preventing fractures. Without enough magnesium, the body may struggle to absorb calcium properly, leading to weakened bones that are more susceptible to injury. Studies have shown that magnesium plays a role in bone mineral density and overall skeletal health. For seniors, adequate magnesium intake is crucial not only for muscle health, but also for supporting strong, healthy bones that can withstand the wear and tear of aging. Research has also demonstrated that magnesium has a positive effect on the body's ability to relax and recover after physical exertion. After a workout or long day, muscles need time to recover and relax. Magnesium helps to soothe tight muscles and reduce post-exercise soreness. For seniors, this can be especially beneficial, as physical activity can sometimes lead to muscle stiffness or cramps. Magnesium helps ease these symptoms and accelerates the recovery process, allowing seniors to maintain an active lifestyle without being hindered by muscle pain. Some doctors recommend magnesium supplements for seniors who experience frequent leg cramps or muscle soreness, particularly if they are not getting enough magnesium through their diet. While magnesium is found in foods like leafy green vegetables, nuts, seeds, and whole grains, many seniors may not consume enough of these foods to meet their magnesium needs. Magnesium supplements can help fill this gap and ensure that the body is receiving the proper amount of this essential mineral. However, it is important to speak with a healthcare provider before starting any new supplement regimen, as too much magnesium can lead to side effects like diarrhea and abdominal discomfort. Magnesium also plays a role in regulating the nervous system, which affects how muscles respond to signals from the brain. Low magnesium levels can cause the nerves to become overactive, leading to involuntary muscle contractions and spasms. Ensuring proper magnesium intake helps to regulate the nervous system and keeps the communication between the brain and muscles functioning smoothly. Magnesium is involved in more than 300 biochemical reactions in the body, supporting everything from energy production to the regulation of blood pressure. It helps maintain heart health by supporting normal heart rhythm, and it works with other vitamins and minerals to balance the body's electrolyte levels. Potassium. Potassium plays a critical role in maintaining the electrical balance of muscles and nerves, making it an essential nutrient for healthy bodily function. It regulates how electricity flows between cells, and this flow is what allows muscles to contract and relax smoothly. When potassium levels drop, even slightly, these electrical signals get disrupted. The result? Muscle weakness, painful cramps, and uncontrollable spasms, especially in the legs. This is something seniors are particularly vulnerable to, as age-related changes in digestion and metabolism can reduce how well the body absorbs and uses potassium from food. As people age, they may not notice at first how a slight drop in potassium affects them. But over time, the signs begin to appear: twitchy muscles, nighttime cramps, stiff legs after walking, or even spasms during rest. Potassium is crucial for the basic rhythm of muscle activity, and without enough of it, muscles can become overactive or overly tense. This explains why many seniors struggle with sharp leg cramps that strike in the middle of the night or after even mild physical activity. When potassium is present in the right amounts, it helps muscles relax after contraction, which is what prevents them from becoming tight and cramping. For seniors, whose muscles are already more sensitive and less elastic due to aging, this relaxation effect is incredibly important. Proper potassium levels allow for smoother motion, less stiffness, and a lower likelihood of painful spasms that can interrupt daily life or disrupt much-needed sleep. But potassium doesn't just work on muscles. It also plays a big role in nerve function. The nervous system depends on potassium to transmit electrical signals between the brain and the body. Every step you take, every time you reach or balance yourself, your nerves and muscles are working together, using potassium to send signals back and forth. Without enough potassium, this system begins to falter. Seniors may feel this as reduced coordination, delayed reflexes, numbness, or even shakiness in the legs. This can lead to a greater risk of falls, a loss of balance, and a reduction in independence. Potassium also teams up with other electrolytes like sodium, calcium, and magnesium to regulate fluid levels in and around your cells. This fluid balance is essential for muscle health, nerve communication, blood pressure, and kidney function. When potassium levels fall, the fluid balance shifts, leading to dehydration, muscle fatigue, and even heart rhythm issues. Seniors are more vulnerable to these problems due to medications, especially diuretics or blood pressure pills, that flush potassium from the system, along with changes in kidney efficiency that happen with age. Studies have shown that a potassium deficiency can contribute to a long list of problems, including fatigue, muscle tenderness, feelings of heaviness, and an overall decline in physical performance. Unfortunately, many older adults don't get enough potassium simply because they're not eating enough potassium-rich foods. Some may avoid certain fruits or vegetables due to dental issues, digestive problems, or medication side effects that affect appetite. Others may follow restricted diets, low salt, low sugar, low fiber, that unintentionally reduce their potassium intake. This makes dietary potassium awareness very important. Potassium-rich foods are easy to find and usually affordable. Bananas, sweet potatoes, avocados, white beans, lentils, spinach, oranges, coconut water, and yogurt are all excellent sources. These foods can be added to smoothies, soups, or simple home-cooked meals. For seniors who can still manage regular meals, a few small additions can make a huge difference in energy, comfort, and strength. However, for those who struggle to get enough potassium from food, supplements may be a necessary option, but only under medical supervision. Taking potassium in supplement form can be risky if not monitored, particularly for individuals with kidney issues, heart problems, or those on medications that affect potassium levels. Too much potassium in the blood, a condition called hyperkalemia, can be dangerous, causing heart rhythm disturbances or even cardiac arrest. That's why it's important that any supplementation is prescribed by a doctor, based on individual needs and lab test results. Potassium isn't just about muscle relief, it's also a critical mineral for heart and blood vessel health. It helps manage blood pressure by balancing out the effects of sodium in the diet. High sodium levels raise blood pressure, while potassium helps flush excess sodium from the body and relax blood vessel walls, lowering pressure naturally. This makes potassium a powerful defender against hypertension, stroke, heart attacks, and other cardiovascular problems that are more common with age. Seniors who maintain proper potassium levels not only feel stronger in their muscles, but also gain better protection for their heart and circulatory system. It's also worth noting that potassium impacts brain health, because the brain relies heavily on smooth electrical activity to control both thinking and movement. A potassium deficiency may contribute to mental fog, irritability, and slower cognitive responses. This is another reason why seniors benefit from ensuring they meet their potassium needs, not just to keep moving, but to keep thinking clearly and reacting quickly to their environment. In practical terms, seniors should aim to include a variety of potassium-rich foods across their day: a banana or orange with breakfast, spinach in a lunchtime salad, baked sweet potato at dinner, and a serving of beans or lentils a few times a week. Drinking enough water is also key, since hydration supports the proper movement of potassium throughout the body. It's a simple but powerful step toward reducing cramps, improving circulation, and feeling more comfortable and confident in daily movement. For those taking medications, regular blood tests are helpful to monitor potassium levels and prevent imbalances. Some may need prescription potassium supplements, which can be taken as slow-release tablets or even liquids, depending on what the doctor recommends. Importantly, you should never self-prescribe potassium. Too little is bad, but too much can be worse. Vitamin E. Vitamin E plays an essential role in maintaining optimal health in seniors, especially when it comes to circulation, muscle health, and cellular protection. As an antioxidant, vitamin E helps protect the body's cells from oxidative stress, a damaging process that becomes more pronounced with age. Oxidative stress occurs when free radicals, which are unstable molecules, accumulate in the body and begin to damage healthy cells. This cellular damage can affect muscle tissues, leading to symptoms such as muscle cramps, weakness, and spasms. For seniors, who often struggle with these issues more frequently due to natural aging processes, ensuring an adequate intake of vitamin E can provide vital support. One of the most important roles of vitamin E is its impact on blood circulation. Good circulation is critical for delivering oxygen and nutrients to various parts of the body, especially the muscles. In seniors, compromised circulation can lead to reduced mobility, pain, and even a higher risk of falls due to muscle stiffness or spasms. Vitamin E enhances blood flow by promoting the flexibility of blood vessels and preventing the formation of clots that could obstruct circulation. This improved blood flow ensures that muscles receive the oxygen-rich blood they need to remain strong and functional. Muscle cramps, particularly in the legs, are a common complaint among older adults. These cramps often strike at night or after physical exertion, causing painful muscle tightening that can interrupt sleep and daily activities. Vitamin E helps alleviate these cramps by improving circulation and promoting muscle relaxation. It also plays a role in supporting the nervous system, which coordinates muscle movements. When nerves and muscles are well nourished and supported by adequate vitamin E, the chances of sudden muscle spasms and cramps decrease significantly. Beyond preventing cramps, vitamin E is instrumental in muscle repair and regeneration. With age, muscles become more susceptible to damage, and the body's ability to repair that damage slows down. Vitamin E aids in the recovery process by reducing inflammation and supporting the production of new muscle cells. It helps minimize the breakdown of existing muscle fibers while boosting the body's capacity to heal from exertion or minor injuries. This regeneration process is crucial for maintaining strength and resilience in aging muscles, enabling seniors to perform daily tasks with more ease and less discomfort. Another critical aspect of vitamin E's function lies in its anti-inflammatory properties. Inflammation is a natural immune response, but chronic inflammation, often seen in aging individuals, can contribute to muscle soreness and joint discomfort. Vitamin E can reduce inflammation by neutralizing free radicals and modulating the EUE immune response. This anti-inflammatory effect can bring relief to seniors suffering from chronic leg cramps or muscle aches. By calming inflammation in the muscle tissues, vitamin E promotes faster recovery and more relaxed muscles. Seniors are often at risk of vitamin E deficiency due to several factors, including decreased appetite, difficulty absorbing nutrients, or restrictive diets. In some cases, medical conditions that affect fat absorption, such as liver disease or gastrointestinal disorders, can also lower vitamin E levels, as it is a fat-soluble vitamin. Deficiency in vitamin E can lead to several muscle-related symptoms, including weakness, poor coordination, and chronic cramping. To counter this, health professionals often recommend increasing intake through diet or supplements. There are many dietary sources of vitamin E that are both accessible and nutritious. Nuts like almonds, hazelnuts, and sunflower seeds are rich in vitamin E. Leafy green vegetables such as spinach, kale, and Swiss chard also provide good amounts of this essential nutrient. Vegetable oils like sunflower, wheat germ, and safflower oil are other excellent sources. For seniors with difficulty consuming enough vitamin E through food alone, supplementation may be necessary. However, it's crucial that supplements are taken under the guidance of a healthcare professional to avoid any risks associated with overconsumption. Excess vitamin E intake can lead to health complications, particularly its effect on blood clotting. Because vitamin E has blood-thinning properties, taking it in high doses can increase the risk of bleeding, especially in individuals who are already on anticoagulant medications. Therefore, determining the correct dosage tailored to an individual's health status is important. The recommended daily allowance for adults over 50 is around 15 milligrams, 22.4 IU per day, though this can vary based on individual needs and existing health conditions. Vitamin E also contributes to overall vascular health by maintaining the flexibility and integrity of blood vessel walls. Aging causes blood vessels to stiffen, increasing the risk of high blood pressure, swelling, and varicose veins, conditions that can lead to or exacerbate leg cramps. By supporting vascular elasticity, vitamin E ensures smoother blood flow and reduces the strain on the cardiovascular system. This, in turn, contributes to better muscle health and a lower likelihood of cramping and discomfort. In cases where seniors suffer from persistent leg cramps, vitamin E supplementation has shown promise in several studies. These studies indicate that regular vitamin E intake can reduce the frequency, severity, and duration of nocturnal leg cramps. Improved sleep quality and reduced discomfort have a profound impact on the quality of life for elderly individuals who may otherwise struggle with fatigue and mobility issues due to nightly disturbances. Vitamin E should be considered a cornerstone nutrient for maintaining muscular and circulatory health in older adults. It works not only to alleviate existing issues like cramps and spasms, but also proactively protects against future complications by reducing oxidative stress, enhancing blood flow, and aiding in muscle repair. Seniors looking to improve their physical comfort and mobility should evaluate their vitamin E intake, both from food and supplements, with their healthcare provider. This nutrient, often overlooked, could be a key factor in living a more active, pain-free life during the golden years. Ultimately, vitamin E offers a comprehensive array of benefits that touch nearly every aspect of senior muscle and vascular health. Whether through nuts, seeds, leafy greens, or medically recommended supplements, incorporating sufficient vitamin E into a senior's routine can lead to marked improvements in comfort, movement, and overall vitality. It's not just about preventing cramps. It's about supporting a more energetic and independent life as we age. Vitamin C. Vitamin C is an indispensable nutrient that plays a multifaceted role in maintaining overall health, particularly when it comes to muscle strength, joint function, and skin integrity. Its importance becomes even more pronounced as we age because vitamin C supports the production of collagen, a fundamental protein that acts as the structural backbone of connective tissues in the body. For seniors, collagen is essential not only for preserving healthy muscles and joints, but also for preventing painful issues like muscle cramps, stiffness, and joint discomfort, especially in the legs, where mobility is crucial for everyday activities. Collagen forms a robust yet flexible framework that holds together muscles, ligaments, tendons, and skin. This connective tissue framework allows muscles to contract and relax smoothly without damage or excessive strain. However, collagen production naturally declines with age, and this reduction can weaken the integrity of muscles and joints. When collagen is insufficient, the muscles can lose their elasticity, leading to increased vulnerability to tightness, spasms, and cramps. This is why vitamin C, which is a critical cofactor in the synthesis of collagen, becomes vital for seniors who want to maintain their muscle resilience and prevent painful episodes of cramping or stiffness. The process of collagen synthesis involves vitamin C helping to convert proline and lysine, two amino acids, into hydroxyproline and hydroxylysine. These modified amino acids are necessary for the formation of stable collagen triple helices, the essential structural units of collagen fibers. Without adequate vitamin C, collagen formation is impaired, leading to weakened connective tissues that can no longer support muscle and joint function optimally. This biological detail explains why vitamin C deficiency can result in symptoms such as fragile blood vessels, weakened tendons, and increased risk of muscle cramps, especially in weight-bearing areas like the legs. Beyond its role in collagen production, vitamin C also has significant antioxidant properties. As an antioxidant, it neutralizes harmful free radicals, unstable molecules that can cause oxidative stress and cellular damage. Oxidative stress increases with age and is one of the leading factors behind muscle fatigue, inflammation, and tissue breakdown. By combating oxidative stress, vitamin C helps protect muscle cells from damage, allowing them to recover more effectively from physical exertion. For seniors, this protective effect means fewer episodes of muscle soreness, reduced risk of cramps, and overall better muscle function. Vitamin C also contributes to immune system health, which indirectly supports muscle repair and recovery. A robust immune system is crucial for healing micro-injuries that naturally occur in muscles during movement or exercise. In older adults, immune function can decline, which slows down recovery times and increases vulnerability to muscle pain and fatigue. By supporting immune defenses, vitamin C ensures that the body can repair damaged muscle fibers efficiently, reducing prolonged soreness and the risk of recurrent cramps. Inflammation, often a byproduct of muscle stress or injury, is another factor linked to muscle cramps and discomfort. Chronic low-grade inflammation is common in seniors and can exacerbate stiffness and pain in the legs. Vitamin C has anti-inflammatory effects, which help moderate the body's immune response and reduce the production of inflammatory molecules that damage tissues. This anti-inflammatory action helps muscles relax and recover more quickly, minimizing the duration and intensity of cramps. Moreover, vitamin C plays a supportive role in the absorption of other vital nutrients, including iron. Iron is necessary for producing hemoglobin, the protein in red blood cells responsible for transporting oxygen throughout the body. Oxygen delivery is especially important for muscle health because muscles need a constant supply of oxygen to function and recover properly. Vitamin C enhances the absorption of non-heme iron, the form found in plant-based foods, thereby indirectly supporting muscle endurance and reducing fatigue. For seniors, better iron absorption can mean improved energy levels and less frequent muscle cramps during daily activities. Dietary sources of vitamin C are abundant and diverse, making it easier for seniors to meet their needs through nutrition. Citrus fruits like oranges, grapefruits, and lemons are famously rich in vitamin C, but many other fruits and vegetables are excellent sources as well. Strawberries, kiwis, and pineapples provide generous amounts, while vegetables such as bell peppers, broccoli, Brussels sprouts, and kale also offer substantial vitamin C content. Incorporating a variety of these foods into daily meals can help seniors maintain adequate vitamin C levels and support their muscle and joint health naturally. Despite its availability, some seniors might still struggle to get enough vitamin C due to reduced appetite, dental problems that make chewing difficult, or dietary restrictions. In such cases, vitamin C supplements can be a practical solution to ensure sufficient intake. However, it's important for seniors to consult healthcare providers before starting supplements, as excessive vitamin C intake can cause gastrointestinal issues like diarrhea or kidney stones in rare cases. Proper guidance ensures safe and effective use of supplements tailored to individual needs. Vitamin C is water-soluble, meaning that it is not stored in the body in large amounts and needs to be consumed regularly to maintain adequate levels. This daily replenishment is critical for ongoing collagen production and antioxidant protection. Seniors should aim for the recommended daily intake of vitamin C, which for adults over 50 is generally around 75 to 90 milligrams per day. However, Individual requirements can vary based on health status, lifestyle, and specific risk factors, so personalized advice from health professionals is always recommended. Vitamin C serves as a cornerstone nutrient for seniors, aiming to preserve their muscle strength, joint flexibility, and overall mobility. Its role in collagen synthesis directly influences the health of connective tissues, preventing cramps and muscle tightness that can severely impact quality of life. At the same time, vitamin C's antioxidant and anti-inflammatory properties protect muscles from age-related damage and support quicker recovery from physical exertion. Ensuring adequate vitamin C intake can help seniors maintain more than just muscle health. It also bolsters immune function and aids in nutrient absorption, critical to muscle endurance and energy. Together, these benefits enable older adults to stay active, independent, and comfortable in their daily lives. Therefore, seniors should prioritize vitamin C through a balanced diet rich in fruits and vegetables, and when necessary, consider supplementation under medical supervision. By doing so, they can significantly reduce the risk of muscle cramps, joint stiffness, and related mobility issues, promoting a healthier, more vibrant aging process.